It's not every day you see sworn enemies in Washington linking arms, but that's kind of what's happening right now.
It really is. We're talking health insurers and hospitals.
Yeah.
Usually they're on opposite sides of the table.
Exactly. Suddenly they're aligned. So, okay, let's unpack why.
Yeah, what's the big threat that's brought them together? Because when you see players like that with, totally different business models suddenly agreeing, it's usually something pretty major.
It definitely is. And that's something which is what we're digging into today is these proposed cuts to Medicaid and this, surprising coalition fighting back. Just for context, this whole thing bubbles up from the budget resolution the House just passed. A resolution, just to be clear, is like a spending blueprint for Congress.
A plan, basically. Yeah.
And this one, it's looking at some hefty cuts to domestic spending, and Medicaid seems to be square in the sights, mostly to pay for earlier tax cuts.
Right. It's that classic tension, isn't it? Taxes coming in, spending going out. And the budget resolution is kind of the first shot at trying to balance those over the next few years.
Totally. So for this deep dive, we looked at some really good pieces from Intelligencer and Politico, and our mission today is pretty straightforward. Figure out what's really driving this whole budget fight.
And crucially, what it could actually mean, in the real world.
Yeah.
For people listening, for the tens of millions who actually rely on Medicaid.
That's the core question, right? How do these high-level DC budget fights trickle down to whether someone can see a doctor?
Exactly. That's what we want to explore.
Okay, so let's get into the roots of this. It seems like the House and Senate, they weren't really on the same page to begin with, past different budget resolutions.
That's right. Different ideas about spending. The House maybe wanting deeper cuts sooner. The Senate perhaps a bit more cautious initially. Even disagreed on how many reconciliation bills, which is that, special fast-track process for budget stuff in the Senate.
And then, apparently, former President Trump weighed in, pushing for just one big, beautiful bill, as the report suggests.
Which sounds like, wanting a single decisive outcome. But jamming two different plans into one bill, that could get messy when you get down to the details.
For sure. And the Intelligencer piece points out the Senate's version was interesting. It basically assumed the big 2017 tax cuts wouldn't add to the deficit.
Pretty rosy outlook.
Yeah, and it didn't have many immediate budget cuts built in to offset things. Kind of kick the can down the road on the spending side.
It's a strategy, right?
Yeah.
Prioritize the tax cuts, hope for growth, maybe deal with the spending implications later.
Right. But then the House agreed to the Senate's framework, but only if, and this is the kicker, only if they could find $1.5 trillion in domestic spending cuts later on.
Ah, the plot thickens.
And as we said, Medicaid ended up being the main place they targeted for those savings. It's like the House said, okay, your top line number is fine, but we've got some serious spending changes we want baked in.
Exactly. And the House, particularly, the Freedom Caucus, they saw an opening there. Agree to the Senate's numbers now, but secure that commitment for big cuts down the line in reconciliation.
And that Intelligencer article really highlights the Freedom Caucus's role here. It says, for them, this isn't just about deficits, is it? It's bigger.
It seems to be part of a much longer-term goal for some members. Fundamentally reshaping the role of government, rolling back parts of the welfare state. And Medicaid is a huge piece of that puzzle.
So for some, the cuts themselves are the point, maybe even more than just balancing the books.
That's a key takeaway from the reporting, yeah. It's philosophical for some about the size and scope of government beyond just the dollars and cents.
Okay, so that sets the stage for why cuts are on the table. But then, boom, this alliance pops up. Health insurers, hospitals, groups you'd think would be fighting each other over healthcare dollars.
Yeah.
Why are they suddenly united against these cuts?
Well, it comes down to pretty fundamental financial concerns for both. They both stand to lose big time.
How so?
For hospitals, it's the fear of more uninsured patients walking in, people who can't pay their bills. That means more uncompensated care, which costs hospitals billions.
Okay, makes sense. And the insurers.
Especially the ones managing Medicaid plans for states.
Yeah.
They'd see enrollment drop. Fewer members means less premium revenue coming in. It hits their bottom line directly.
Right, pure business logic there. The Political article actually quotes someone from the Modern Medicaid Alliance.
Yeah.
Yeah, talking about the sheer size of this. Potential impact on 70 million Americans. I mean, that number is just staggering.
It really puts it in perspective, doesn't it? Shows just how embedded Medicaid is in the whole U.S. healthcare system. Cuts that big,
Yeah.
they'd ripple through everything.
And this isn't just, quiet disagreement. These groups are really mobilizing. Politico mentions hospital execs flying into D.C., lobbying hard.
And big ad campaigns too, right? Six-figure ad buys.
Yeah, that's serious money. It shows how worried they are.
Absolutely. You don't spend that kind of cash unless you see a real fundamental threat to how you operate, how you serve patients.
There was a quote in that Politico piece from the CEO of Sanford Health, Bill Gasson. He called Medicaid an investment we simply can't afford to lose.
That's powerful framing.
It is, right. Changes it from just a line item, a cost, to something essential for the whole system's health.
Yeah, framing it as an investment in communities, in health, not just an expense. That's a strategic message aimed at broadening its appeal.
Okay, but let's look at the other side. Some Republicans in the House, according to Politico, are saying, hold on, we're not trying to cut benefits.
Right. The argument is often about efficiency.
Yeah, Representative Vern Buchanan, for example. He's quoted saying the focus is on tackling waste and fraud in the system, not taking away care from people who need it.
That's a standard line you hear when cuts to social programs are discussed. Assure people you can find savings by, trimming the fat, cracking down on abuse without hurting the actual recipients.
But the Democrats are pushing back hard, aren't they? They're saying, look, $880 billion over 10 years, which is a figure Politico floated.
That's a huge number.
You just can't find that much money by rooting out waste alone. They argue it has to hit services eventually.
And, most policy experts would probably agree. Finding nearly $1 trillion just from waste and fraud with zero impact on benefits or access, that seems, well, highly optimistic, let's say.
Yeah.
Extremely difficult.
And it seems like this is causing some heartburn even within the GOP. Politico mentioned that letter from 6 Republicans.
Ah, yes, the ones from districts with lots of Medicaid recipients.
Exactly. They warned Speaker Johnson against making huge cuts, suggest they're hearing it from folks back home feeling the pressure.
It shows that tension, right, between the party's broader fiscal goals and what individual members are hearing from their own constituents, the real-world impact.
Although, interestingly, those same 6 lawmakers ended up voting for the budget plan.
They did, after getting assurances, apparently.
Yeah, Politico said they got assurances from Speaker Johnson that enrollees' benefits would be protected, which raises questions, given the numbers we're talking about.
It really does. What kind of assurances? How concrete are they? It sounds like a very tricky balancing act for those members. Show fiscal restraint, but promise constituents their health care is safe. We'll have to see how that plays out.
And it's not just the House showing some caution. Senate Republicans also seem a bit wary of deep cuts, right? Also talking more about waste and fraud.
Senator Tommy Tuberville's comments in Politico seem to kind of downplay the idea of big benefit cuts happening.
Again, that focus on waste. But as Politico points out, getting the kind of savings they need without touching benefits for individuals or reducing payments to states.
Yeah, which share the cost of the program.
Right. It's really hard to see how they square that circle. The math just looks tough.
Extremely tough. The scale of savings required makes it very challenging.
So, okay, let's say they do push forward with cuts. What would that actually look like? What kind of policy changes might be on the table? Politico mentioned a few possibilities.
Yeah, there are several tools they might consider. One is work requirements for some Medicaid recipients, though those have faced, legal hurdles and debates about whether they actually save money or just kick people off coverage.
Right. What else?
They could reduce the federal matching rate, the FMAP. That's the share of Medicaid costs the federal government pays for each state.
Ooh, so that would just push more of the cost onto the states themselves.
Precisely. Which could force states into really tough spots, maybe cutting eligibility or reducing covered services or cutting payments to doctors and hospitals.
That sounds like it could cause chaos at the state level.
It could definitely strain state budgets.
Yeah.
Another idea is capping federal funding overall, maybe per person or just a block grant to states. Predictable for the feds? Maybe, but risky for states if costs spike, like during a pandemic or recession.
Any others?
They might also look at provider taxes. These are taxes states levy on hospitals or other providers, often used to help fund the state's share of Medicaid. Reducing or getting rid of those could impact how states finance their programs.
Wow. Okay, so none of those sound like simple administrative tweaks. They all seem like they could have pretty big real-world effects.
They absolutely could. Each one impacts how the program functions, who gets care, and who pays for it.
Now, Politico made a really interesting point about how all this gets talked about, the messaging. Whether these changes get framed as cuts or as reforms.
Oh, absolutely critical. Language matters hugely in these fights. If opponents Democrats, the Hospital Insurer Alliance, successfully brand these as harmful cuts.
Whoosh, sounds bad.
It generates public backlash, makes it politically harder to do. If proponents can frame them as necessary reforms to improve efficiency or ensure sustainability,
Which sounds responsible.
then they might gain more traction. It's a battle over perception.
And it looks like the Democrats are already going hard on the cuts narrative, right? Highlighting potential harm, especially to rural hospitals, vulnerable groups. Senator Patty Murray's comments in the article fit that mold.
Textbook strategy, and often very effective. Focusing on the potential negative impacts on real people and communities really resonates and puts pressure on lawmakers.
But on the flip side, Politico emphasizes how determined many Republicans are to make the 2017 tax cuts permanent. And that determination is really fueling the search for savings elsewhere.
That's the crux of it, isn't it? The commitment to those tax cuts creates this powerful need to find offsetting spending reductions.
And Medicaid, just because it's such a large program.
It inevitably becomes a major target, even though it's politically sensitive. The sheer size of its budget makes it hard to ignore if you're looking for trillions in savings.
Okay, so wrapping this up, we've seen how this House budget plan put major Medicaid cuts on the table.
Which then sparked this pretty unusual alliance between insurers and hospitals, both worried about the financial fallout.
Right, and we've looked at the different currents within the Republican Party, some pushing for big structural changes, others getting nervous about the impact back home.
And we touched on the potential ways these cuts could actually happen. Work requirements, funding caps, changes to state matching rates.
Plus, that whole crucial battle over whether this is called cuts or reform.
And underlying all of this, we have to remember the sheer number of people involved. Over 70 million Americans rely on Medicaid.
Right.
These aren't just abstract budget numbers. They translate directly into access to health care for a huge chunk of the population.
Absolutely. So as we finish this deep dive, maybe a final thought for our listeners to chew on. When you weigh all these factors, the drive for fiscal cuts, the push to keep tax cuts, the industry's financial fears, the potential hit to millions of people, what do you think is the biggest force really shaping this whole debate right now?
And maybe looking ahead, whatever happens with this specific budget fight, what could be the longer-term ripple effects on how healthcare works in America? Definitely something complex, with huge stakes, worth keeping a close eye on.